Hi, I'm Bob Schrupp, physical therapist,
Brad Heineck, physical therapist.
and together we are the most famous physical therapists on the internet.
Well, in our opinion, of course, Bob.
Brad, in all the discussions and videos that we've done, I don't think we've ever done one on a platform wheeled walker. And it's very simple. This is the platforms that make up the platform
Right here.
walker. And there's a couple cases in which these are really valuable and will work with certain types of patients.
Right.
So that's what we're going to discuss today. We're going to discuss some of the different platforms that you have. I guess, do you first want to show the platforms, Brad?
Well, let's
We're
talk
gonna
about who's it good for. We talk about it's good for someone that's had a stroke and is unable to grip with one hand. And of course, then you don't have to have a walker with both platforms on. This one could come off, and if their left arm was weak or hand was weak and they couldn't grab here, then you put it on
Right.
there. And then in that case, because that whole arm could be actually almost flaccid, you may have to Velcro it in so that it doesn't fall off.
Yeah, two things to mention about people who've had a stroke. Generally, as things start to get better, they get stronger, what we call proximally first. So the shoulder gets better, then the elbow, then the wrist, and then the
Right.
hand. So they might have decent arm strength here, but they don't have wrist or hand strength
Sure.
yet. So they're able to tolerate leaning on there, but they can't grip very well. Or
Right.
they might be able to grip just enough to hold on to this.
Right.
The other thing is, when you're trying to recover from stroke, what is always good is weight bearing through that limb.
Mm-hmm.
So if you're having trouble with that arm, to put weight through it is actually a good thing.
It's gonna strengthen the shoulder, of
Yeah,
course.
it's gonna help the nerves, I think.
Re-educate.
Re-educate them, yeah,
Mhm.
so in that kind, and like Brad said, you don't need the other side on then. But there are cases where I've had people where they broke both wrists.
Mm-hmm.
I've had people that have really bad arthritis, rheumatoid arthritis in the wrists. And they
Right,
just can't
right.
tolerate grabbing onto it. I've just had people that really have to lean. They're because their legs are so bad, they can't, their wrists and hands just can't tolerate, but they really need to lean on the walker. And it works well with
Right.
that.
You better believe it.
Now these Brad adjust up and down, of
Right.
course. And what we thought was interesting about this one, this actually is kind of a.
It's good demo model.
Yeah, it's a good mutt, basically, isn't it?
Yeah, this one actually has 3 different types of clamps to attach the platform to. This is just a standard walker.
Yeah, regular walker is all
Right.
this is.
You have to have one that has the bars across. Some walkers don't have this one, and that's not as well for this type of platform. But you just simply can loosen these up, and you loosen this up, and then this can slide up and down. That's how you'll adjust it. And I gotta tell you, Bob, I like to have 2 people to put these on, because these clamps are kind of like you need 3 hands to do it. It makes it easier. You
Yeah.
can do it by yourself, but it's a lot easier. I'm gonna leave this here
Yeah, leave
because
it on.
I
It's
wanna
for the
keep this
patient.
one, yeah, and I don't wanna throw it off for the patient. But you just simply loosen it up, and then
It can be moved up and
Yeah.
down, telescopes up and down,
Yeah.
somewhat almost. Is that
that's
the
just
word?
all interference fit. Works off of that friction there. Okay, so, and here we've got, these are actually a different model, but the same concept. Thumb screws, tighten it up and down. All right.
By the way, you can see here, this green material here, that's a shelf liner. And actually, I think the reason this was put on here, Brad, is somebody was using this walker and they wanted, it was hard on their palm.
Right.
So I think that's why we put it there. And just another tip that you can try with your walker.
Right. Obviously, this is not used when this person's using it. This was for a different person that didn't need the platform.
Right. So that's platform walker. We often use it with wheels on the front, but it works really well, and I recommend that you may want to try it if you're having some of those difficulties.
Right, you know, as far as adjusting this, maybe we should do another video on what's the proper adjustment for a person.
Oh, sure.
Okay, very
We'll do that.
good. Look for the next video.
Yeah.
Be
Subscribe.
careful.
Subscribe.
Yeah, have fun.